there, so you can let me know when it's time. Right. Good afternoon and welcome to UnitedTV. My name is Kemal Erkan. Today, we are second time we are doing this on a different day other than Friday because we have a very special guest. Today, we are honored to be joined by one of the most influential voices in American healthcare, Seema Verma. She's the former administrator of CMS and one of the largest federal agencies in the United States, and overseeing programs that impacted over 140 million lives in America, and currently serves as the executive vice president at Oracle. And we are going to have a lot of discussions that's going to help for those who are looking for better solutions in healthcare. And knowing Seema's experience, I know her leadership is already making a huge impact. And now we are going to start our discussion and welcome her.
No, it's my pleasure to be here. Thank you for having me.
How's everything? How are you doing? Last time we saw each other was last October at the dinner. So I'm hoping that we'll be able to see each other again this September at Oracle Health Conference. So first, I really know how much, knowing how much work you do and how busy you are. I appreciate for your time being with us. And this is an important time for all of us, understanding healthcare, making changes on healthcare. And Oracle has this new role in the last 3-4 years that's actually, in my personal opinion, making a huge impact. And being part of that is always kind of giving me the peace of mind so that we know that not only we are going to be okay, but we are going to be leading. So, but I want you to kind of let us, tell us your side and what you do and how you see certain things. So if I know your time is limited, so I want to start with our first question. Now, my first EMR implementation, that time with PowerChart, it was year 2001. We start our relationship with that formerly known Cerner with PowerChart in May 2000. And of course, I have probably done so many EMR transitions, implementations in the outpatient settings. And our goal was always to see if this is going to help our providers to kind of alleviate some of the administration work that they do right now, or they did in the past. So now we have a lot of feedback that we get from everyone who are utilizing EMR. And I have my own opinion on some of these, but knowing Oracle is already putting a lot of work into this, how is Oracle integrating these technologies into the EHR system that is going to make change in the healthcare provider's life, and then maybe change the providers diagnose and treat patients? How do you see that?
Yeah, that's a great question. But let me start with the problem that we're trying to solve, right? So, just to kind of back you up, 3 years ago, Oracle made one of the largest acquisitions in healthcare, and that was the acquisition of Cerner. And I think at that time, Larry, it was right after, on the heels of COVID, right? And I think it kind of further demonstrated to him a lot of the core dysfunction that we all feel in healthcare, right? Whether you're a provider or a patient. And I think during COVID, that was, front page news every single day. And I think we all experienced, and I think it was more highlighted during that time. And Larry's been thinking about healthcare for many, many years, right? We have a large footprint in life sciences where we do clinical trials. So Oracle Health has done that for a while. But I think at that time after COVID, he wanted to do more and really kind of thought about his career and everything that he's done. And he's spent a lot of time in technology and transformed a lot of industries. And then it was, let's come to healthcare. Let's bring everything that he's learned, or the company has learned through databases, through, whether it's human resources systems, whether it's through transforming other industries and communications, restaurants and hospitality. And let's try to transform healthcare. Now, lots of people have said that, right? It's almost kind of a buzzword when we hear about that. Everyone's transforming healthcare. But what I think is different about Oracle is that they do come to it with a mission orientation, right? And Larry says, I can't think of a better way to end my career than trying to help healthcare. So we start with that. And we come to it with the notion that solving healthcare has significant implications, not only around for doctors and for patients, but for countries at large. So in my former role, I was the administrator of CMS. So there wasn't a healthcare issue problem that I didn't have to deal with at some point during my tenure there. And what I found was that, we're spending so much money in healthcare, whether it's in the United States or with countries around the world. And yet for that investment, we have poor health status overall as compared to other industrialized countries. In the United States, we have poorer health outcomes. We're also spending a lot more money on administrative costs. So 25 to 30% of the healthcare dollars spent on administrative costs. And at the end of the day, people aren't very happy, right? There is a lot of growing dissatisfaction with the healthcare system. And I think doctors and nurses and everybody's frustrated. And I'll be the first one to say technology is not going to solve all of these problems, but there's a lot that we can do. I think it's also fair to say that technology hasn't exactly served the healthcare industry well. And if we look at the tools and the things that our workforce is using today, a lot of them are antiquated. I mean, it's fair to say that in parts of the healthcare system across the country, we're still using fax machines.
Right.
And relying on very outdated technology, and I would say almost outdated user experiences, right? It's super easy to, go shopping. It's super easy to do all kinds of banking, all kinds of transactions that are very easy to do. But then when we come to healthcare, the experience and the interfaces that we have are antiquated. And that's because the EMRs that were built, both Cerner and our competitor, they were built in the 1990s. So this is old technology. And it's hard with old technology to adopt new modern innovation. It takes longer. It's harder. It's, you're bolting on things into an old infrastructure. And so when we come at it from Oracle, we looked at the Cerner infrastructure, and our focus now is to build a brand new EMR, the EHR of the future. This is an EMR that is going to have artificial intelligence embedded at the core layer. And so it allows providers to use automation, to use AI as a tool to help them reduce a lot of the manual burden. It also gives them the opportunity to use AI to help them in clinical decision support. Now, I'm the first one to say AI is not going to replace the provider, not at all, but it is a tool. It's a great tool for them, right? If you think about it, we like to say that the EMR, instead of being a record, right, a record of information, it is now a system of intelligence. And it's almost like having an assistant, not an administrative assistant, but more like your best resident at your side. So you can ask it questions like, tell me, what's the recommended dosage for this? What are the interactions? Those types of things that a lot of times providers are having to look up, they're having to recall. And things are happening so fast in medicine. There's so much innovation going on that you need to have that information at your fingertips, whether you're at a big, large academic health center or you're in a small rural facility. We want to also bring more tools to the table that help actually lift quality of care, and so that we have more consistency and quality no matter what setting you're in. So I would say that's one of our major focuses. And then that first one is around reducing burden. And I think we've already started to see in the market a lot of ambient listening tools where you can go in and listens to your conversation, and for the provider generates the note. But what's even more exciting is now take it from there. They could do autonomous coding, and AI can actually, conduct the entire workflow that makes the doctor be able to focus on what doctors are best doing, right? Which is diagnosing and figuring out the treatment plan, not having to do all this mundane work. So we hope by reducing a lot of the burden, I would say the administrative burden for doctors and for nurses, it gives them more time with patients. And that really helps address some of the access issues that we're having. It's kind of getting hard to make a doctor's appointment these days.
Mm-hmm.
And then secondarily, I think we help the workforce. We're hearing that people are retiring early and they're frustrated because of all this burden. And I think this will help bring back the joy to the practice of medicine. So that's our overall goal.
So as I'm listening to you, one of the things that I was going to say before we even start, I was in Turkey 2 weeks ago. As you know, we have an office there, mainly supports our services in the United States. It's our internal outsourcing office. We have a lot of RCM resources, a lot of clinical resources there. Other than our main office in Wilmington, Delaware. And the reason this time I was also there is because I was one of the participants at Eurasian Economic Summit. This is one of the foundations that I'm a member of, Marmara Foundation. And we have almost 800 people attended, 40 different countries, all current, former ministers, presidents. It was so many A-list people there from their own field. And one of the focus this year we had in healthcare, because every country is spending more. And as I'm listening, some of you said so many things very, very quickly. One is like sustainable healthcare is, how we can make this sustainable. And one of the things that I use as an analogy is, in the old days, this cutting ice in 1920, 1930, it was so important to be so efficient. And then there's the refrigerator came in, and then boom, everything, all that efficiency is no longer it's all obsolete. And we have a healthcare that's designed in 50s, 60s, 70s. Life expectancy change, a lot of new procedures being done. People who are over 65, how many different procedures they may be able to get covered by Medicare or their other insurances. And knowing that this is becoming a more expensive item for countries, states, individuals, if they don't have proper insurance. So I'm always optimistic. So I know this is going to be different, and I know already we see some of the differences. And I want to give one example to the efficiency that we get from Oracle by utilizing our systems, our surgical module, SurgeNet we call. We were the first one in the United States implemented SurgeNet in our surgery center. I own one of them. And right now, Seema, this is kind of interesting to me, at least. There is a AAA reviewer who's on site. So they have a site visit today and tomorrow. And I'm able to come here and in the main office do this without thinking what's happening in the surgery center. We got the surgery center in 2015. It was actually almost like, it felt like 1890. Everything was paper, everything. There's nothing you can access. And I remember the first AAAC audit, and this is an accreditation for most surgery centers. They may have a couple other accreditations. And it was a nightmare. They used to work 3 months just for this. We do this for every day. So we have zero prep almost because of the system we have in place, and that's powered by Oracle, and it's our SurgeNet, our power chart, and it's amazing. So if someone could tell me that I would be able to leave the surgery center during this time, because everyone needs to be there to support each other and then find something, and just being there present, it was important. But it would be a dream, but today we are able to do it. One other thing that I want to tell you with our AI utilization, as you know, United Medical is one of the early adopters of these new technologies with Oracle. And now my providers are reporting as they're using the AI. it's a different, like they can just do like the way that we are just talking without typing and without not looking at the patients, having a real conversation, and not to worry about what they were going to document, what they were going to type, what they were going to remember. And that's a huge game changer. And I believe Oracle supporting this on the healthcare side is going to be an example for most of the other companies who are in healthcare. So now I want to switch gears to your responsibility on the CMS, if we can. So when I say this, some people don't really get it. So now you may be already used to this, but you are one of the most powerful people in healthcare in the United States, therefore probably in the world. So people really don't get this. So let me just actually elaborate this. So right now, CMS's budget, which you were in charge of, it's about 3 to 4 times of the country of Turkey, where I'm from. And you were, this entity is not some small entity. It's like 3-4 times of some big size countries. So now with your expertise and everything that you have done there, is there any ways to accelerate this, like applying the technology and accelerate these changes to the proposed changes that you had during your time at CMS? And are you now able to kind of see that connection and kind of completing it?
Yeah. So when I left government, right, we spent a lot of time studying the problems there and actually putting together some regulations. One of the things that I wanted to work on, or that was really trying to spend a lot of time on, was interoperability, right? Mm-hmm. Which is that patients are moving around. They don't really stay in one place, to your point, right? They may be at your surgery center one day, and then they may be in an outpatient setting another day, and they may be in another town or even in another country. And so we need portability of that medical record, and data needs to follow the patient wherever they go. And so when I was in government, in the United States, they had a digitized health system. So they had that, but what they're still struggling with is interoperability. And so during my time in government, I put a lot of rules in place to require those types of things. But my experience was, Kemal, that you cannot necessarily, government can't solve all of these problems, right? There's these problems, these are longstanding problems, and you can throw a lot of money at it. You can change some of the rules and the regulations, but at the end of the day, it's the private sector, it's the technology innovation that's best suited to solve some of those types of problems. And in my new role, right, so it's focused on the United States, and Dr. Oz has that job now, so I'm rooting for him. But what I have found is that the problems that the United States faces is really the same problems that all the countries are facing. So if you're in one of our big customers is the NHS. When I go to the UK and you hear what they're talking about, we're all facing the same problems. It's burnout, provider shortages. Now, the good news is people are living longer. So that's a good thing, but we're not prepared in terms of the workforce, right? We don't really have enough people to solve that. So that's where, and the government, what can the government do, right? We can encourage people to go into healthcare. We can give them scholarships. But the reality is that's going to take years, and you have an immediate concern right now. And the opportunity for technology to come in there and provide some of these tools, it's very possible we can use more paraprofessionals, right? It may be easier and more efficient for the doctor to see more patients or have more, better quality time. So I do think that government can only take it so far. They can provide money, they can provide policy, but the actual doing at the end of the day has to be done by the private sector or the technology or some other sector, or even the doctors and nurses on the front lines.
So with the interoperability, with these silos being not connected, and how we are going to be able to break this, now you kind of got into that a little bit, but now I know there are bigger plans. I remember from last year, it was part of I was one of the panelists at the Oracle event, and then I hear Larry Ellison kind of saying similar things, and I felt like if I was copying him, but no, I didn't know he was going to use that example. But this whole credit card and the financial information that credit card companies use. That's maybe most people don't really understand or hear that much. Can you explain this, breaking down these silos and how Oracle approach is different than the others?
Yeah. So I think if you think about it, back in the day, we can all remember a day when all of healthcare was on paper, right? And your medical file was in the doctor's office and probably put in a file cabinet. And then when we digitized the system, right, we went to an electronic health record, then the data was actually locked in your doctor's computer. So if you think about it, you see different doctors, then the data is sort of locked. And the idea of interoperability is that data can be passed around, moved around, just like we do in banking, right? In banking or credit card, where you're able to look at all the information from different places and bring it in one instance, so you have that comprehensive information, and then you can make decisions. And that's the whole concept behind interoperability. And so it's one thing, you kind of see countries around the world that are moving towards digitization. They want electronic health records, which to me is the first step, but you want to do both together. You want to make sure you have digital data, but it also needs to be interoperable. And the data needs to be able to move freely. And it also, you need to be able to speak. So you have to have some standards, right? So if we're exchanging information, that we're all speaking the same language. So if we say hemoglobin A1C means this, and we're all kind of defining terms in the same way. Otherwise, we may not understand when we're transferring data. So one of the things that Oracle's very focused on is this concept. And you heard Larry talk about it, because that idea of data, managing data, moving data is something that Oracle's been doing for years. We do it in banking, we do it in finance. And so we have a long history and know how to do it. What's been sort of what I find actually quite disturbing was that when I was in government and I started talking about this concept, right? Patients should own their data, they should have access to it. They should be able to move it wherever they want to do it. And it was actually the electronic health record companies that were fighting it. They did not want this regulation. And I think people have, felt like the data was valuable, and it is. But at the end of the day, we have to do what's right for patients. Right. So what's right for patients, what's right for doctors is having that information. I think it's hard for doctors to spend a lot of time just trying to spend 10 or 15 minutes just trying to understand the patient's history, right? And wouldn't it be better if AI was able to bring in all of the data and summarize it and give them kind of a short, hey, here's what you need to know about the patient. These are the medications, this is their history. Instead of us having, and as patients, we're repeating ourselves over and over again. You have to tell everybody, the same thing again and again, your history. And, we're going to forget things. We're not going to remember what medications or what the names are, what the, how much of the medication are we taking. So that's what data liquidity, that's what interoperability is all about, and what we're focused on. And we don't believe that the data belongs to us. We want to help all institutions, whether it's providers or payers or even researchers in life sciences and pharmaceutical companies, take advantage of that data. And we sort of see ourselves as the center of that ecosystem, enabling the connectivity and the data movement.
So, just to kind of echo what you are saying, what was happening, and again, that time I had 11 of my employees, our leadership managers, they were with me. And I'm like, if something happens to me right now, we were in Nashville that time, right? So no one knows anything about me, about my health situation, what medication I'm taking, but yet it's in the cloud, it's there.
Yeah.
But then you cannot access if you are not in that, if the main goal is the patient care and improve the patient care, I think those things, I think you said something really important. Sometimes, when companies have a horse in the race, or sometimes government, they have a horse in the race, so they kind of don't want these changes. But I think Oracle is leading in that, and I do believe that we are already seeing, right now we are using seamless exchange in our EMR with PowerChart, and it's kind of like the habit of people going into different portals, logging in, and then I have to remind our people. I do daily case conferences with 2 different teams every day for the last 4 years at minimum, or maybe 5, I don't know, but let's say 4 years. And now, the last 3, 4, 5 months, I've been telling them, hey, did you check the outside records in the EMR without going anywhere? You know, it used to be only with the external RX history, but now we have everything that's potentially available to us before you log into some other portals. Go in there and check. And it's just, again, it's a game changer when you are not only able to see it, but you can actually bring it to the chart.
Right.
It's amazing. So, and we sometimes make things way too easy. So then people really don't see how grateful, how great these things are. But I think in time, everyone is going to adapt and understand. And right now, like we spend so much time and money outside of our system, connect with those systems, and then you came in and then you said, okay, Kemal, here's the outside records on your chart. Go to the seamless exchange, and it's done. It's over. Like we don't have to worry about all these, maintaining those and keeping up with that. It's I think this is kind of like the when I was giving my speech with the sustainable healthcare, the hope was we have to have good tools and new policies, of course, available for us, for population. So then these can actually probably happen a little bit quicker. Now, one of the other issues that we see is potential benefits of knowing that there's a potential benefit of modernized HR systems. Many healthcare providers, facilities, they have difficulties making this decision on kind of cost and complexity of implementation from one to the other, one EMR to the other, one EHR to the other. How is our approach at Oracle to address these concerns and making sure that we have a smooth transition in place?
Right, and that's a great question, and that's where this is where government is important, right? Because a lot of times you have one EMR company, even if Oracle wants to exchange data or we're willing to exchange data, you have to have the cooperation from other electronic health records. And that's where the government's been helpful, and where governments around the world, I think, are more cognizant that we have to say, that this is required. This is what's right for patients, so let's do that. And then you have to have the standards in place to be able to do that. So we're built to be able to do those data exchanges, and we try to make it as freely as possible. The other thing that we try to do is what we call an API strategy, which allows not only just the exchange of data, but if there's other applications that are out there, to allow them to sit on top of our systems as well. Maybe you've got something that is a great predictor, or let's say it has something to do with infant mortality, and there's some technology there that can help you deliver better outcomes and healthier babies. We allow for that connection into our software through these open APIs as well.
Mm-hmm. So hopefully, I think the cost still is concerning for many, and I know there are people who wants to switch, who wants to join, and I see opportunities, and hopefully, we can look into those to see. Now, again, with this seamless exchange, I was just checking my notes, and also like the entire clinical data exchange. I think some of these things are going to kind of be resolved on its own, because the information is already there, and probably that's why those EMR companies didn't want to have these things readily available, because they would maybe lose business. Now, we kind of maybe I forgot, or we I don't know if I missed it, but now we have a new system coming up on the practice management side, and we have a couple different names for it, but Oracle Health Patient Accounting, Patient Administration, Patient Portal. I would like to kind of see how we are doing with those. We are going to be going live with our surgery center on the new system. How is that working out so far? What's going to be available for those who are already using Oracle and who may want to use Oracle?
Yeah, so When we think about AI, right, we spent a lot of time today talking about the provider experience, patient experience, but that's only part of it. And when we look at healthcare, after the doctor's visit, there is a lot of complexity around billing and getting approvals from insurance companies. So when we think about our approach and the solution, if we're going to tackle healthcare, we can't just do it with the electronic medical record. You really have to go end to end. And if we're trying to reduce friction and abrasion, we have to think about those interactions with the payers as well, right? So let's say you need an authorization from the insurance company. Yes, we're going to pay for this test, and there's a lot of back and forth that you have to go through. And so we believe that we can bring artificial intelligence to all of this, right? So even our financial systems, and it starts with, right now we're seeing AI being used to generate the note, but AI can also be used for coding. So it just autonomously says, here's the codes that we recommend. And of course, the doctor has to sign off on it. And then you automate all of the coding and then really automate the submission of the claim. And to be able to work with the insurance companies, whether sometimes they want more data and more information, to electronically retrieve that information. And then if the claim is accepted, great. So you're trying to increase your clean claims.
Right.
The things that we're working on is real-time claims adjudication. If we can kind of clean up and understand all the insurance rules on the front end, then we're saving providers time. We're helping them correct the claim, make sure it's got everything that it needs before it's even submitted, so that it can be adjudicated quickly. And then what's exciting, so essentially on revenue cycle and Oracle patient accounting, we're bringing the same kind of approach, right? As much AI as possible, as much automation as possible. And you're going to see that when we talk about the patient portal, right? The patient plays an important part here, whether it's paying co-pays or scheduling appointments. But, patients also want to understand their information and data. So when we talk about the ability to use ambient listening or to be able to use search criteria, we're going to bring all of that to the electronic health record as well. So instead of having to consult GPT or Chat GPT or some of those other AI, it's all sort of embedded into the actual patient portal as well. So that's an exciting uplift that we expect to see. But again, it's just bringing AI across all of it. Some of the things that we're working on with the insurance companies around automated prior authorization. How do we make sure that from the very beginning, you have to do the prior authorization? We can auto-generate the request. And then we're working with the payers to say, okay, if we can bring you this auto-generated, can you help adjudicate it so you can do it more rapidly? And what we're finding is even from the insurance companies is they're anxious to move forward because they want to reduce their own administrative costs. So everybody's looking for savings. I think we're all driving towards creating more efficiency and more automation to reduce these administrative costs.
Now, I'm sure you are already aware of some of these, but from United Medical side, we did work with your team on Oracle Health EHR, Patient Administration, and Patient Portal as design partner. My team, we have a group of people here, and being part of that, actually, and also Oracle working with its own people, its own clients to include us to see how we can actually help and make sure that real life flow in these offices are reflected and understood. It was important for us, and we thank you for the opportunity for that as well. And then, every time there's something new, we want to be the first to try. So that's why we are usually the beta partner in many cases. So, but also, I want to make sure that people understand in the outpatient setting, I have not seen any better system in place because it's not just with one module of the system itself. It's not just the AHR, it's not just the PM, it's the whole thing. And one of the biggest advantages that I see in the last 25 years working with your company, the support that we get and the constant improvement on, we are not buying something that it's getting old, now we have 5 years from now, we have to buy something brand new versus every 3-4 months there's some updates that's as needed is happening, sometimes without us knowing. These are important, and that's why in Delaware we are providing Just at the primary care level, 115,000 patients. We are a small state, but 115,000 patients, a lot of patients at the PCP level, and that's powered by Oracle. So I think that's also important for people to know. Now, these are all work-related questions. I have one more. What do you think the biggest opportunity for healthcare technology is going to be in the next 5 to 10 years?
Yeah, I think it's going to be the use of AI, right? I mean, I think bringing AI in across the board. And I hope that we're delivering, I think even from Oracle, but from all tech companies, right? We can't bring solutions to the market that are not going to deliver value. Because to your point, is it going to be so expensive that it's cost prohibitive? The idea is to deliver efficiency. So I think the technology, when people are buying technology, I think that's what the litmus test should be. Does it deliver you value? Does it actually let your job? Is it easier to do your job? And does it create savings, right? Does it automate some of the work so you don't need as many people to run the system? So to me, it's AI and the ability of people to use AI on an ongoing basis, because I think this is all changing rapidly. It's changing so fast that we want to build an open platform so you can use our technology. You can build your own AI, or you can go use somebody else's. But the reality is it's all changing so fast, and we need to create something that allows you to embrace that technology, use it, figure out whether you like it or not, or move on to something. And it shouldn't be these long decision-making processes, right? So when we we're kind of an all-cloud model, all software as a services. You don't have to make these updates, right? Those updates just come, just like you see that in your phones and things like that, where, one night you just get an update and the next day things are actually working better and you have new features and functionalities, so that we can let, the healthcare system focus on healthcare, focus on getting patients healthier.
Well, thank you so much for all these, understanding and now having one-on-one and hearing it from you. That actually makes me feel much, much comfortable with everything that we are doing and how much you already know about these things and then working on them. From our side, I'm sure other people, when they hear you, maybe first time in our United States, United Medical Network, they are going to be hear you directly. They're going to be able to hear. Tonight we have a ACO in-person meeting. I say in-person because now, after COVID, everything changed. Every 3 months we meet. There will be at least 60 to 70 providers. With our people together, we probably have 75 to 85 total people. And we hear their frustration day to day, and then knowing that we are able to support them best. And then I want to also know and hear directly from you. What you just did today is amazing, and spending the time with us. So I have one little side question. So not because I promised that I was going to behave. So now you worked with Donald Trump directly.
I did.
Now I wanted to actually tell you this. So I have two sisters, one older, one younger. My older sister is amazing in terms of how she takes care of everything for us, the entire family. And now she works with me in the Turkey office. My younger sister, she's higher up in the government in Turkey, and one of her role is working with the Minister of Family and Social Services, and she's in charge of the women's status in that ministry. And I see challenges women have every day, and still the equity, equality, this all comes up all together. Now, you, with your background, working with Trump, how was that? I'm not looking for any juicy details, but you did a great job, I know, and he picked you. How was that working relationship with him? Yeah,
you know what? I think people are probably surprised to hear me say this, because I think there's a lot of rhetoric out there when it comes to the president. But, I started working with the Trump organization during his first campaign. So a very long time. And I was with him through the last day of his first term. So all the way through. And the reason why I lasted so long was because he was good to me. On a personal level, he always had my back, always kind of protected me. And, it's a tough environment, but I always felt like he had my back. The other thing I would say is that he really valued my opinion and he gave me a lot of latitude to do whatever. So there was a lot of trust between us where I think he said, look, go fix healthcare. I felt like I had a good understanding of what his goals were, what his accomplishments were. People thought that he was against Medicaid, that he was against helping people, get health insurance. And, I had some very direct one-on-one conversations and he really felt strongly about people having access to healthcare, really wanted to see things improved. And, he opposed the Affordable Care Act because he felt like it was actually increasing costs for people and actually, creating problems for different types of people. And so we really connected on that because I think we shared that same value about trying to improve the system and wanting to make sure that every person had access to high quality healthcare. So I enjoyed my time there. Certainly one of the most difficult jobs I have. My current job's hard too, but that was hard in a different level. But what kept me there over the 4 years was the relationship that I had for him. So he valued my opinion. I think there was a lot of trust in our relationship, and a lot of, he was a great boss. I think there was one time, I heard Sarah Huckabee Sanders talk about him at the convention, and she talked about, I think, a way that we don't really see that President Trump, he was just, sometimes I would call it almost fatherly. He could be very tender and supportive. When we see him on TV, we don't necessarily see that side of him, but, always very positive, very encouraging. He'd give me a call and he's like, hi, I saw my Seema on TV today. So it was a pleasure to work with him and an experience of a lifetime and something I'm very grateful for and grateful to him for that opportunity.
Excellent. I'm glad to hear all this, and I guess that was the case because you stayed there for the entire time, and if it was not the case, then you wouldn't stay for that. And we want to see more women in these positions, qualified people. But when they are doing their jobs, they shouldn't have any difficulties. And because of my sisters, I'm always on their side. And seeing someone like you succeeding and doing what you are doing even today, you are building much more to what you did at CMS. And this is amazing. And having you also here for almost 45 minutes is also amazing. And I know this is going to be helpful for many of our providers and in some cases for our employees and our patients too. So,
well, it's a pleasure to be here. You guys are doing exciting things and we appreciate that you work with us and the development of these products. We have a great technologist, but we need those providers on the front lines that tell us what to build and what's going to work and what isn't going to work. So we appreciate the partnership.
Well, thank you so much. And thank you for everyone watching us. Well, stay united. Bye-bye.
Thank you very much. We appreciate it. Good to see you again.
Good to see you. There, so you can let me know when it's time.